Good day! I'm Demirish M. De Maano from Olfu Bachelor of Science in Nursing-3. Today, I will demonstrate the proper taking of blood pressure together with the vital signs which are the body temperature, radial pulse, and also the respiratory rate of a patient. But first, why do we need to take vital signs? Vital signs are critical component of patient care, and they matter at every appointment because they are useful in detecting and monitoring medical problems. Also, taking vital signs can help assess a person's general physical health, give clues about possible diseases, and also shows progress toward recovery. Now, let's begin by taking the temperature of the patient. First, prepare equipment such as thermometer, cotton balls with and without alcohol, and also a wristwatch with second hand. Next, wash hands before proceeding to the main procedure. After that, identify the client and explain the procedure. But remember to not say that we will observe the respiration or respiratory rate in order for the client to not get conscious and for us to get accurate results. Also, keep in mind that we must provide privacy during the entire procedure and place the client in an appropriate position. Good morning, ma'am. May I enter the room? So, hi ma'am, I'm Demirish and I will be your student nurse for today. So, ma'am, do you prefer me to speak in English or in Tagalog?
Tagalog.
Okay, so, ano pong pangalan niyo, ma'am?
Demirish.
Ilang taon na po kayo?
23.
Okay po. So, ma'am, check ko lang po yung ID band niyo. Okay po. So, ma'am, ang gagawin po natin ngayon is kukuhanan ko po kayo ng vital signs. Yun po yung temperatura nyo at saka pulso. Okay po?
Okay.
So, ma'am, position ko lang po kayo. Ayusin ko po kayo. So, okay naman po ba kayo dyan? Okay po, ma'am. So, sisimulan ko na po yung procedure. Obtain the thermometer from the container. Wipe the thermometer with cotton ball with alcohol from the bulb to the stem. Then dry it using a cotton ball in the same manner. Also, check the battery and the thermometer itself if it's functioning. So, ma'am, linisin ko lang po muna yung thermometer. You are now ready to instruct the client to open his mouth and raise the tongue, or just place the thermometer in the client's axilla. So, ma'am, lagay ko na po yung thermometer sa kilikili niyo. Okay, ipit na lang po. Now, leave the thermometer. So, while waiting, the nurse may begin to count the client's radial pulse and respiratory rate. Now, let's begin taking the radial pulse of the patient. So, while taking the client's body temperature, position client's body temperature and then begin to assess the radial pulse rate. Support client's wrist by grasping the outer aspect of the thumb, place index and middle finger over the client's artery and palpate the pulse. Count to 1 full minute using the wristwatch with second hand and assess the rhythm and volume of the pulse. So, ma'am, ngayon naman po, kukuha na ko na po kayo ng pulso. Okay po? Now let's begin taking the respiratory rate of the patient. After taking the radial pulse, do not remove the fingers from the wrist but observe chest movement while supposedly taking the radial pulse. We do not inform the client that we are observing their respiration as they might get conscious about their breathing, resulting to inaccurate measures. Now proceed in counting the respiratory rate for 1 full minute. An inhalation and exhalation are counted as one respiration. This is observed by the rise and fall of the chest wall. Also, observe the depth, rhythm, and character of the respiration. After that, remove the thermometer from the client's axilla and read it at eye level. Wipe the thermometer with cotton balls with alcohol from the stem to the bulb. And then return the thermometer to its proper container. So, okay na po ma'am. Kunin ko na po yung thermometer. Okay po. So, linisin ko lang po muna ma'am ha. Ayusin ko na rin po yung yung position niyo po ulit. Okay po na. Lastly, wash hands and document the reading of the body temperature, radial pulse, and respiratory rate of the client. So, ang temperature ni ma'am ay 36.8 degrees Celsius, normal. Radial pulse is 63, normal din. At ang kanyang respiratory rate ay 15, so normal. There are a lot of factors that can affect a person's blood pressure, such as their age, weight, race, family history, lack of exercise, alcohol intake, use of cigarettes, stress, and many more. Now, let's begin taking the blood pressure of the patient. First, wash hands before starting the main procedure. Next, Determine the client's baseline blood pressure and which extremity is the most appropriate for reading. Also, prepare the materials and select a cuff size that completely encircles the client's upper arm without overlapping ends. After that, identify the client, explain the procedure, and place them in an appropriate position. Ma'am, may I enter the room?
Okay.
Good morning, ma'am. I'm Demirish and I am your student nurse for today. So, ma'am, do you prefer me to speak in English or in Tagalog?
Gamit po.
Okay po. So, malaman ko lang po ano pong full name nila.
Demi Limaan.
Okay. Ilang taon ka na po?
23.
23. So, tignan ko lang po yung ID band niyo. Okay po, ma'am. So, ang gagawin po natin ngayon is kukunin ko po yung blood pressure niyo. So, ma'am, tanong ko lang po, ano po yung last na reading sa inyo?
110/70.
Okay po. Ano po yung madalas na gamitin kamay kapag sa blood pressure po?
Sa kanan.
Kanan po. Okay. So, position ko lang po kayo, ma'am. Tapos, ma'am, sisimulan ko na po yung procedure, okay? Now, move the client's clothing away from the upper aspect of the arm. Position the arm at heart level, extending elbow and palm turned upward. Have client relax the arm and not overly tighten elbow. So, ma'am, lagay ko lang po itong una. Ganito nyo lang po yung kamay nyo. Relax lang po kayo. Sangat ko lang po yung sleeves. After that, wrap or apply the deflated cuff snugly, smoothly, and evenly around the upper arm. For an adult, place the lower border of the cuff approximately 2.5 centimeters or 1 inch above the antecubital space. Then insert the earpieces of the stethoscope into the ears with a forward tilt. Ma'am, lagay ko na po yung cuff sa kamay niyo. Suot ko na rin po yung stethoscope. Relocate the brachial pulse and place the bell or diaphragm directly over the brachial pulse. Hold the diaphragm with the thumb and index finger. Mamanapin ko lang po yung pulse. Now, inflate the cuff to 30 millimeters of mercury above the normal systolic reading of the client. Then release the valve of the cuff carefully so that the pressure decreases at the rate of 2 to 3 millimeters of mercury per second. As the pressure falls, identify the manometer reading by listening to the carrot cuff sounds. Mark the first audible sound as the systolic pressure reading and the last audible sound as the diastolic pressure reading. After the last sound has disappeared, deflate the cuff rapidly and completely and remove it from the client. Keep in mind that we must wait for 2 minutes before taking a second reading. Okay, ma'am, tatanggalin ko na po yung cuff. Tapos, wait po muna tayo ng 2 minutes para po sa second reading niyo, okay? After waiting for 2 minutes, take a second reading. And then after that, inform the client of the reading and position them comfortably. So, ma'am, sabihin ko na po sa inyo yung record or yung readings nyo. So, yung first reading nyo po is 110/70, which is normal. And yung second reading nyo naman po is 110/70 din, which is normal din po. So, okay na po tayo, ma'am. Thank you po. So, ayusin ko na po ulit yung paghiga. Thank you po, ma'am. Pahinga na po kayo. Lastly, put all the equipments in a proper place. Wash your hands and remember to document all the pertinent data. Okay, ang blood pressure ni Ma'am Emily is first reading 110/70, normal. Ang second reading is 110/70 rin, normal din. So, okay na. All the procedures are now done. Thank you for watching. Bye!